Hello, this is Dr. Emily Kubat from InspireLifePT.com, and today I have my first guest, Dr. Rohini Kumar, and so she is a physiatrist. So will you tell us a little bit about what that is?
Sure, thank you for the invite, and I'm honored to be the first guest on your program. And I'll walk our viewers through what physical medicine and rehab is. PM&R once stood for plenty of money and relaxation, and that's fake news, my friends. It doesn't stand for that. It is, the field is rehab medicine, so using whatever tools we can, exercise primarily, to help a patient heal. We work with anybody who has a long-term functional deficit from their injury. So it could be a stroke patient, traumatic brain, cancer patients, and that's where we work together with breast cancer patients. So if there's any musculoskeletal, anything that affects the joint, the muscle, or pain that restricts them from progressing with you, that's where I like to get involved. So we do joint injections, we do injections into muscles to help with improvement in what we call range of motion and helping them to get to their next level of fitness so that they can get back to where they need to be functionally for their own home life, family life, and just personal happiness. We all, I think, are on the same team to restore that function, improve their quality of life in whatever capacity we can.
And so if I have somebody that's having a hard time progressing with therapy because they're really having a lot of pain or other difficulty like that, then I will send them to Dr. Kumar, and then she will work her magic. And we just really work together like that.
Yeah. Some things that patients are curious about are acupuncture, and that's a great tool we use to help the body heal itself by hitting certain pressure points that allow pain to be better controlled, improvement in spasms. It helps with headaches, post-concussive headaches, and anxiety and depression, which we see in a majority of our patients because whatever devastating life event, if it's, like I said, spinal cord injury, traumatic brain, a new cancer diagnosis, all of these things have a great psychological impact and can cause that reactive depression and a reactive anxiety. So I like to use the acupuncture as a very therapeutic treatment for those things.
Now, people are always really curious about acupuncture. Now, does it hurt?
It doesn't hurt me. It feels like little mosquito bites. So if you can tolerate that, the outcome shouldn't, the needle shouldn't impact your desire to try, because it is something that the tap of the needle goes in so quickly. Majority of people do not feel it. We have patients that have chemo-induced neuropathy from their treatments, and so they don't feel it at all because of the neuropathy. So there's a benefit in that. But I think most people would say it's a little prick, and I don't do anything to stimulate the needle or dig it too deep. It's a very superficial needle. If anything, people itch a little bit because of a histamine reaction on the skin.
Okay. And then how often can or should someone have acupuncture done if they're having positive benefits from it?
I would say monthly is a good cadence, because if someone has to pay for it out of pocket, that is something they can usually afford. We could do it as frequently as weekly for some patients with different forms of addiction, and that they've seen better outcomes with more frequent use.
Okay, awesome. And then if someone wants to come and see a physiatrist, do they need a referral, or how do they go about doing that?
Majority of people do need a referral. We are a specialist group, so you can ask your primary care doctor, you can ask your orthopedic surgeon. We like to offer things that are not surgical interventions to help you get the relief you need, be able to progress. So the referral base can come from anyone. It can come from your surgeon if it's breast cancer. So you just have to ask them that I would like to work with a PM&R doctor to help coordinate my care and or get me to the right therapist.
Awesome. Sounds great. So I hope you guys know a little bit more about physiatry, physical medicine, and rehabilitation. And if you have any questions, make sure you let us know. Have a great day.